We give a little bit of love to the older kitties in this pet health tip of the day segment, especially those that are suffering from a little bit of kidney ailments.
Hello again, everybody. Dr. Langlois here with your pet health tip of the day, and I am on location, and again by that I mean just right down the hall. And I wanted to introduce you to somebody. This is Ruth, and it is Adopt a Senior Pet or Senior Animal Month here in the month of November. And one thing that senior cats can be prone to, and a lot of people have to deal with, is chronic renal failure or chronic renal disease. And I don't really want to get into too much of exactly what causes it, but one of the treatments that we do give is periodic or sometimes even daily fluids under their skin, just to help keep them hydrated and get their kidneys working as best as possible. Now, for some people and for some cats, that requires sticking them with a needle every single day while we try to treat them or maintain them in these states. And that can be very difficult for cats and sometimes for people who just, don't really want to deal with the needles. Well, did you know there's actually something you can talk to your vet about, and it's something that we have here in Ruth, and unfortunately since I'm a little far away you can't see it too well, but it's a special kind of catheter, and it's a catheter that kind of is implanted under their skin, and what it does is allows you basically to just do what I'm doing now, which is petting her while she's getting her fluid treatment. And she's not reacting at all, the fluids are nice and warm, and there's no needle sticks. It just kind of plugs right in with a little port, and as you can see here, she's free to move around. She can walk around, you can pet her, you can give them a little bit of food, all of that stuff. So that's really important. It's something where we don't want needle phobias, or as in the case with Ruth, it would be very, very difficult because she really does not like the restraint or the needle sticks. So we went ahead and put this in, and it works really, really well for her. She gets her fluids pretty quickly, probably in about 5 minutes or so, or less. She doesn't even really know they're going in, and it's much more comfortable for everybody. And it actually can prevent euthanasias due to the fact of lack of ability to deliver fluids. So ask your vet if you do have a cat that has a little bit of trouble, tolerating sub-Q fluids or needs them daily, about potentially putting one of these sub-Q catheters in. It's not for every cat, and it certainly is a case-by-case thing, but it is something you want to talk to your vet about, especially in some of these older guys or gals, like Ruth here, who actually will be going to a home hopefully next week, which is really, really nice, to be able to give them their fluids. And with sub-Q fluid therapy, we have seen cats sometimes go 2-3 years with chronic renal disease or chronic renal failure that have maintained very well and had very good quality of life. So make sure to think about it, and if unfortunately your cat is stricken with a little bit of chronic renal disease and needs fluids on a fairly consistent basis, don't forget to ask your vet about it. So we're just about to finish up Ruth's fluids here, but that is your no needle stick pet health tip of the day.
As always, if you have any questions about the kidney health of your pet, be sure to check out some of these websites, or even better yet, make a call or make an appointment to have your older kitty checked out by your vet today.